Hello, my name is Catherine Morrow. I'm an assistant professor in the Department of Pediatrics at the University of Ottawa and a researcher at CREX. Today I'm going to be describing one study that is a part of my larger program of research that focuses on the engagement of patients and caregivers in medical education, including assessment activities and program evaluation. Today, I'm going to be introducing to you an assessment tool that we have created at the Children's Hospital of Eastern Ontario and in the Faculty of Medicine at the University of Ottawa. This tool is entitled The Parents. It is a new tool for involving parents in the assessment of physicians. In order to develop The Parents, we used a participatory development process. The Parents is a tool that caregivers can use to assess and provide formative feedback to their children's physicians. In order to provide you with some insight into the types of questions that we are exploring in this study, I would like you to choose one of the following hats to wear. For example, if you are a physician or a healthcare provider, you may want to reflect on the following question. If you could ask parents or caregivers about your interactions with them, what would you like to know? Alternatively, if you're a parent or a caregiver, you may ask yourself, if you were asked to provide feedback on physicians' interactions with you and your child, what would you feel comfortable commenting on? The objective of this study is to develop an assessment tool entitled The Parents. The Parents is designed for caregivers of children under 13 years of age to assess the non-technical skills, so that may be the communication, the collaboration, the professional etiquette, of physicians who are their main healthcare providers during visits to pediatric emergency departments. In comparison to the assessment of technical skills, non-technical skills in pediatric emergency departments have not traditionally been well assessed. And as a result, we require innovative methods to assess and improve physicians' non-technical skills in these environments. We also recognize that it is important to learn in practice from patients and their caregivers. And as a result, we wanted to develop an assessment tool that could be used in everyday practice. We believe that reflection on practice is important, and when assessment tools are designed in a collaborative way, the data from them can be used as a motivator for encouraging professional development activities. With increased emphasis being placed on family-centered care and patient-centered care, we are also interested in exploring different ways to engage patients and their families in physician education, including assessment activities through the use of multi-source feedback. We recognize that caregivers and their patients often have unique firsthand experiences and can bring very different perspectives to both the educational and assessment activities. Research in this area has also been very limited. Researchers have focused mainly on adult patients' assessments of their physicians, and systematic reviews have shown that existing assessment tools have undergone minimal validity and reliability testing. We also know that the existing tools do not pertain to Canadian pediatric emergency contexts, and that the tools that do exist have not been developed in collaboration with caregivers and physicians, a piece that we thought was very important in our current study. Given the dangers of using poorly developed assessment tools as well as inaccurate assessment data to inform clinical practice, our team is using the standards for educational and psychological testing to inform the development of The Parents. Specifically, we are focusing on the collection of 5 sources of validity evidence for the tool, namely content evidence, response process evidence, internal structure, relations to other variables, and consequences. For the purposes of this presentation, I am going to be focusing on and describing how we collected content evidence and response process evidence for The Parents. In order to establish the content evidence of The Parents, our team met to discuss the purpose of the tool. We decided that the tool should be used for formative purposes to help physicians improve their non-technical skills and interactions with caregivers. In future, we also thought it would be important to use data from the parents to evaluate educational initiatives and target instruction and resources efficiently. We also conducted a series of focus groups with caregivers and interviews with staff physicians and residents. In these focus groups and interviews, we asked the participants about the ideal format of the parents, as well as relevant and observable behaviors in physician-patient-caregiver interactions. We also completed a document review in which we collected and adapted items from other measures designed to assess patient or caregivers' perceptions of physicians' non-technical skills. From these focus groups, interviews, and document review, we identified 62 unique items that correspond to one of the following 4 domains: professional etiquette, situational awareness, interpersonal sensitivity, and communication. However, we recognized that it was not feasible to pilot this long 62-item version of the parents in busy emergency departments. And as a result, we needed to shorten this tool. In order to shorten the tool and further enhance the content evidence of it, we invited 20 caregivers, 5 staff physicians, and 6 residents to review the long version 62-item parents. They were asked to note any unclear items, match each of the items with the most fitting domain, and rank order each item for inclusion. Through this systematic process, we were able to develop a much shorter 20-item version of the parents. In order to collect response process evidence for the tool, we then invited 20 caregivers at CHEO to complete the shorter version of the parents after their interactions with physicians in the emergency department. We used a series of cognitive debriefing methods in order to understand how they recalled information and to note any difficulty that they had with the general items on the tool. We found that caregivers understood the parents, that it was easy to complete, but that some general wording and formatting changes were needed. Here is a snapshot of some of the key items that are now included on the parents. So where are we headed from here? We are now piloting and assessing the psychometric properties, feasibility, and consequences of using the parents to assess physicians' non-technical skills in 4 Canadian pediatric emergency departments, namely BC Children's, Stollery, Sick Kids, and CHEO. Throughout the development process of the parents, it was also identified that teenagers may have very different perceptions of the physician-patient interaction, and as such, we are now exploring different ways to adapt the parents for use by teenagers aged 13 to 18. In closing, I'd like to bring us back to the 2 hats and 2 questions that I posed to you at the beginning of this presentation. Specifically, for those of you who are focusing on the physician question, I'd like to ask you again. If you could ask parents or caregivers about your interactions with them, what would you like to know? Alternatively, if you are asked to provide feedback on a physician's interactions with you and your child, what would you feel comfortable commenting on? I'm happy to hear your suggestions and would encourage you to contact me by email. Thank you very much for listening to this presentation.